loneliness or obesity, which is more health hazardous. Being connected to others socially is widely considered a fundamental human need, crucial to both well-being and survival. For example, infants in custodial care who lack human contact fail to thrive and often die. Social isolation or solitary confinement has been used as a form of punishment. Loneliness and social isolation represent a greater public health hazard than obesity, and their impact has been growing and will continue to grow. Julianne Holt-Lunstad, professor of psychology at Brigham Young University, presented at the 125th Annual Convention of the American Psychological Association. Approximately 42.6 million adults over age 45 in the United States are suffering from chronic loneliness. More than a quarter of the U.S. population lives alone. More than half of the population is unmarried. Marriage rates and the number of children per household are also declining. These trends suggest that Americans are becoming less socially connected and experiencing more loneliness. To illustrate the influence of social isolation and loneliness on the risk for premature mortality, Holt-Lunstad presented data from two meta-analyses. The first involved 148 studies, representing more than 300,000 participants, and found that greater social connection is associated with a 50% reduced risk of early death. The second study, involving 70 studies representing more than 3.4 million individuals primarily from North America but also from Europe, Asia and Australia, examined the role that social isolation, loneliness or living alone might have on mortality. All these studies show a significant and equal effect on the risk of premature death, and exceeded the effect of well-accepted risk factors such as obesity. There is robust evidence that social isolation and loneliness significantly increase risk for premature mortality, and the magnitude of the risk exceeds that of many leading health indicators. With an increasing aging population, the effect on public health is only anticipated to increase. But, many nations around the world now suggest they are facing a loneliness epidemic. The present challenge now is what can be done about it. A greater priority should be placed on research and resources to tackle this public health threat from the societal to the individual level. For instance, greater emphasis could be placed on social skills training for children in schools. Doctors should be encouraged to include social connectedness in medical screening. People should be preparing for retirement socially as well as financially, as many social ties are related to the workplace. Community planners should make sure to include shared social spaces that encourage gathering and interaction, such as recreation centers and community gardens. These are some of the ways to escape from social isolation and loneliness which significantly increase the risk for premature death. Thank you.